Good afternoon. My name is Chris Rowena, Lead Communications Analyst at Health Workforce Development. We're excited that you've joined us today for the Small Rural Hospital Improvement Program, or SHIP grant webinar. Before we begin, I'd like to discuss a few housekeeping items. Number one, our webinar is hosted in Microsoft Teams. If you're not familiar with the platform, you can find the view controls and the chat feature in the menu bar at the top of your screen, as well as the raise your hand option during our question and answer session. Number two, the webinar will be recorded and posted on our website in approximately 7 to 10 business days. Number three, today the chat option will be open for asking questions during the presentation, and we'll be answering those questions during our Q&A session, which is at the end of the webinar. And number four, all the resources for today's presentation, including the slide deck, are linked in the chat box, and all of the resources can also be found on our website. And with that, I am thrilled to introduce Nathaniel Dixon, Program Manager for SHIP.
Hi, good afternoon, everyone. Thank you for joining us. As Chris noted, my name's Nathaniel. I'm a Program Manager for the Small Rural Hospitals Improvement Program. And yeah, ready to dive in. Next slide. So for today's presentation, we will be running a quick overview on the SHIP program itself. We will be reviewing hospital eligibility, allowable projects, important dates for the application and program cycle, and the application process. This webinar is intended to be useful to both existing grantees, current grantees for the program, as well as new applicants, since we are opening it up to new applicants with this program year. And I do want to note that for existing grantees, we did transition our application process to the HCAI funding portal, so it's now on the same platform as HCAI's other various programs, and so we will be going over some of the specifics about the new application process in this webinar. So to get started with the SHIP overview, SHIP provides annual grants to help small rural hospitals meet value-based payment and care goals. This is done through investments in hardware, software, and training, and with the intent of improving quality of care to underserved populations, in this case in rural areas. SHIP is administered through HCAI and the California State Office of Rural Health, and we receive our funding from the Federal Office of Rural Health Policy, FORP, who I often refer to as just the feds as I'm going through this. So when I refer to the feds, that's typically who I mean. Next slide. So to discuss available funding, the SHIP fiscal year is June 1st through May 31st of each year. The specific grant amount is announced each year by HRSA after all applications are submitted. Every eligible applicant will receive equal funding so long as there is funding available. And continued yearly funding is dependent on receiving those federal funds. So if anything occurs that the feds are unable to provide the funds, then the program doesn't have any money to award. But that's just one of those little asterisk notes we got to mention. Next slide. So why SHIP? As I mentioned, SHIP provides financial incentives to support improvement of quality of service, reduce medical errors, improve hospital financial processes, and all that is done through those investments in hardware and software and in training. Essentially, SHIP offers you a bit of extra money to pursue those goals. The program also offers networking opportunities and training and educational opportunities. Most of those are offered through the feds. Being a participant in SHIP, you'll get regular updates from them regarding networking and training and educational opportunities. HCAI does offer, I believe it's twice a year, a seminar through our Office of Rural Health that SHIP grantees are welcome to attend as well. Next slide. So hospital eligibility, pretty straightforward. Participating hospitals must be in California and they must be located outside metropolitan statistical areas or be located in a rural census tract of an MSA. So you have to be serving a rural population. The hospital does have to be non-federal. It has to be a short-term general acute care facility. You do need to staff 49 beds or fewer. If you have more beds than 49, then the application does request written confirmation that you staff 49 or fewer. And you do need to meet federal priorities as specified in the yearly application. The application will cover that if there are any from year to year. As an additional note, hospitals may be for-profit not-for-profit, tribal, and/or faith-based. Those are all okay. And critical access hospitals are automatically eligible, independent of other requirements here. Next slide. All right, so allowable projects. There are a number of classes of projects that SHIP grant funds can be applied to. Those various project classes fall under 3 categories, which we've detailed here. We have value-based purchasing investment activities, which is activities intended to support improved data collection and to facilitate quality reporting. Accountable care organization or shared savings investment activities, which support the development of the basic tenets of accountable care organizations and shared savings programs. And then we have payment bundling or prospective payment system investment activities, which are intended to improve financial processes such as billing at your hospital. Next slide. These are some of the specific project types within the value-based purchasing category. We won't go into detail on any of these, but I do want to make sure they were listed here so everyone kind of had a high-level idea. In VBP, you can spend SHIP grant funds on quality reporting data collection and related training or software, MB-QIP data collection and related training, efficiency or quality improvement training in support of other VBP-related initiatives, provider-based clinic quality measures, and alternative payment model and quality payment program training and education. The next slide. Payment bundling and prospective payment systems. That covers stuff like ICD-11 software, ICD-11 training, efficiency or quality improvement in support of other related initiatives, S10 cost reporting training, and pricing transparency training. Next slide. And then accountable care organization projects include computerized provider order and data entry, pharmacy services training, social determinants of health screening software and training, efficiency and quality improvements in support of related initiatives to ACO, mobile health and telehealth hardware and software, community paramedicine hardware and software, and health information technology training in this category. And I want to call attention to the mobile health and telehealth hardware and software option. I know telehealth is becoming increasingly common in our current environment, and so SHIP funds can help facilitate that for your hospital if necessary. Next slide. So application and award process. In covering this, I want to start with important dates regarding the application and award cycle. The application cycle opened on December 4th of 2023, so a little over a week ago. Today, December 13th, we're having our technical assistance webinars, and the application cycle closes on January 15th. After the application cycle closes, and I'll touch on this a bit more later in the webinar, we will review applications, and if we see a need for any kind of edits or changes to the applications and work plans that have been submitted, we reach back out to hospitals about that and request edits and corrections, and those edits and corrections are due back to us by March 15th. The program year starts on June 1st. That's also when new grant agreements will start. And then come March 1st, 2025, year-end report cycle opens up. We'll hold a technical assistance webinar for year-end reports 2 weeks after that. And then on April 30th, the year-end report cycle closes. We will not cover the year-end reports in depth today. As noted here, there will be a technical assistance webinar when the year-end report cycle opens. I do want to note that due to federal deadlines, failure to submit an application by January 15th, our deadline, or necessary edits by March 15th may result in loss of grant funds for this program year. And that does apply even to existing grantees with existing grant agreements in place. Existing grantees are required to submit a new approved work plan each year. And if we don't get that information to the feds by deadline, it puts the funding at risk. So it is very important to follow these application deadlines and the application edits and corrections deadline. Next slide. Application process. So as I noted earlier, we did move the application. Previously, we were using Qualtrics for the application. We have moved it to the HCAI funding portal, which is HCAI's intended one-stop shop for applying for all of our programs that we offer. Most of our programs are already there. SHIP was one of the ones that hadn't quite caught up yet, and this year it has. The HCAI funding portal allows users to prepare, submit, edit, and review applications and work plans and year-end reports. And you'll be able to track your grant payments in the portal as well. It is located at the URL shown there. And I believe this will be on our website in about a week, so you'll have access to the URL on our website as well. Next slide. So from the start, before submitting your application, you will need to create a user profile on the new portal. So after navigating to the portal, you will simply click Create Account in the upper right corner of your web browser screen. And next slide. That will take you to this first screen of the user profile where you will choose your user profile type. The user profile type is important because it determines which applications you will see and be able to apply for. We have a category specifically for SHIP. It is Organization for Small Rural Hospital Improvement. So in creating your user profile, you will want to make sure you choose that specific user type. Next slide. We do ask the user who's creating the user account to submit some contact information. This contact information will be associated with your SHIP application, but will not be carried over directly to your SHIP application. Anyone familiar with the SHIP application knows that we typically ask for 3 points of contact: CEO, CFO, and SHIP coordinator at your hospital. While it is likely that one of those 3 is the person creating this user account to submit the application, that's not necessarily a given. And so we do ask for that contact information again, which means you may end up entering the same information you give us here on the user profile on the application. But this way we have a point of contact for the application, just in case it's not one of those 3 people. Next slide. And then once your user profile is created, you'll be able to begin your application. You will simply click Apply here on the upper left corner of the header of HCAI's funding portal site. That will bring up a list of programs that you are eligible for based on user type and which are open right now. So if you selected the Organization for Small Hospital Improvement user type, right now, all you will see is SHIP 2024. You can click that. That will open up a pop-up that shows some high-level information about the program and has the Apply button, which you will click to begin your application. Next slide. This slide was intended, I'm sorry, we have had this issue earlier as well. These slides are moving around on us. This was intended to be useful information about the application process in general. So I guess taking a step back regarding the funding portal, participation requirements, all hospitals seeking a SHIP grant must submit an application and work plan each year. That includes existing grantees who already have a grant agreement in place. We require a new application and a new work plan each year. Hospitals with an existing grant agreement with HCAI provide their work plan via the application, and that's why we require the new application each year. And while navigating the application, you'll use the Save and Next buttons to save and progress on the application, and the Previous button to return to the previous page of an application if necessary. The image there shows what those buttons look like, and they're located at the bottom of each page of the application. This does mean that as you are working on the application, you hit Save and Next, you move to the next page, it saves your progress. So if you need to get up, walk away, and come back to the application later, we do enable that. You do not need to complete the application in one sitting. Next slide. Let's see. To continue an in-progress application or to view a submitted application, you will click on the SHIP Applications in Progress and Submitted option in the header. It's highlighted in this image here. That will bring up a list of applications you have started or submitted. And each of those will have a small drop-down menu button on the right side of your screen. You will use that to open the dropdown. That dropdown menu will include an edit option if you have an in-progress application, and it will have a view option if you have a submitted application. So use that to edit an in-progress application or view one you have previously submitted. Next slide. The application sections. So once you begin your application, there are multiple pages to it. We don't have screenshots of all the pages. But I did want to cover the basics of what we're collecting on the application. If you have previously applied for SHIP, and have a grant agreement in place already, what you see in this new application will be very familiar. We haven't really changed the questions. We've just changed how we're collecting them. So the first page of the application will be a general information page. That is where you'll enter some basic information about your hospital, which we will use to confirm your hospital's eligibility for the program. You will also at that point enter the contact information I mentioned earlier. We request contact information, email, address, phone number, and name for your CEO, your CFO, and your SHIP coordinator. The second page of the application is hospital information, where we collect some additional information about your hospital that we report back to the feds. And then we move into pages looking at the investment activities you intend to propose. So these pages are repeated for each of the three categories. There's one for ACO, one for VBP, one for the payment bundling system. And in each case, you're provided a list of the different options under that program category. You will select which project or projects in that category you are proposing, and you will write up some brief information about the project you would like to undertake. We also have work plan information pages, again, repeated for each of the three categories. For every project you select, you'll give us additional information about your proposed project, and we use that information to confirm your project's eligibility for the program. If you're new to the program, it's not quite as simple as just checking one of the boxes for one of the allowable projects. We do require some details about how you plan to use SHIP funds in pursuit of the project you've selected. Next slide. After you've provided work plan information, there is a budget page. We ask you to provide an estimated budget for your proposed projects. Essentially, this page asks you to take the expected award amount, which we do provide at $13,011 based on last year's award amount, and just give us an estimated breakdown of how much money you're going to spend in each of the three project categories. If you've only chosen projects from one category, you'll put all the award amount into the one category. But if you've chosen projects from multiple categories, we just like a ballpark figure of how you're going to split that up. After that, there is a page for network consortium expenditures. So if you have any kind of network or consortium activity, you will report that on that page. And then lastly, before submitting the application, we do have a page where you can upload a document specifically for the 49 or fewer bed count I mentioned earlier. If you do on the application indicate you have more than 49 beds, this is where you'll upload the documentation indicating you staff only 49 or fewer of them. Next slide. Once all the applications are submitted, HCAI staff will review them. We check each application to ensure hospital eligibility, and then we check to make sure the projects are eligible. If edits are necessary, HCAI staff will reach out to you. We will kick your application back to the in-progress state. You will be able to edit it from the funding portal, and we'll reach out to you and let you know what changes are necessary. We do our best to offer what advice we can on how to kind of fine-tune your project descriptions if we feel it might be necessary. If you've provided us project descriptions for projects that simply aren't allowable, we'll let you know and offer what suggestions we can on how you might modify your project to fit SHIP's eligibility requirements. These edits, like I mentioned earlier, are due to us by March 15th, 2024, and due to federal deadlines, failure to submit those necessary edits by that deadline may result in loss of funding. If you do not get funding because of a missed deadline or an eligible project or whatever reason, whether you're a new or existing grantee, you are not prohibited from applying again next year. So even if you don't receive funding this year, you will be able to apply again next year and go again without any penalty. If after submitting your application, no edits are necessary, we will contact you to let you know that's the case. We won't just leave you in the dark. We'll let you know, hey, your application looks good. We'll be passing it along to the feds. Next slide. And then the award process. So as I mentioned, we pass the eligible applications along to the feds. We do that in April 2024. All eligible applicants are awarded if there is funding available. The final award amounts are determined by the feds after they reviewed all applications, not just for California, but for the country. At that point, they'll look at how much funding is available and how much funding each hospital can receive. That number may be different than the budget you presented on the application, but again, the budget on the application is intended to be more of an estimate, so that's not the end of the world. HCAI will contact applicants and grantees as soon as we know what the award amount is going to be. And then awards are paid out at the end of each program year after you submit your year-end report, which is used in part to confirm you completed the projects you proposed on your application. Once we get that back from you, we cut the check. for the award amount. Next slide. SHIP grant agreements with HCAI are multi-year, ending on May 31st, 2028. So existing SHIP grantees already have a grant agreement with HCAI in place with that end date. New grant agreements to new participants each year will start on the appropriate program year start date. So if you're applying for the first time this year, your grant agreement will start June 1st, 2024. But it will still end May 31st, 2028. Every grant agreement is intended to handle multiple years. Existing grant agreements may require amendments to reflect changes in funding. We wrote the grant agreements to avoid that need, but there is always a small chance that need will arise. And if it does, we will work with existing grantees to get those amendments in place. Important to note that we do use DocuSign to process all grant agreements and amendments. All documents we send you will be sent to you through DocuSign and must be signed and executed through DocuSign. If that is not an option for your hospital, it is often the case that various hospitals have their own kind of internal signature process. We will do what we can to work with you in that, but the final execution has to be through DocuSign. So there has to be some means, whatever your process for signing internally is, to get that back into DocuSign to process through on the HCAI side. If we can't process it through DocuSign on the HCAI side, we can't execute the grant agreement. And then as a note, documents are sent by default to the CEO information provided on the application for signature. If that is not the correct person, you can reach out to us to let us know. We can pass the documents along to whoever needs to sign. Again, it just has to be through DocuSign. Next slide. Work plan changes and amendments. So it is the case that, sometimes you'll propose a project on the application. You'll get a few months into the program year and maybe that project's not panning out. Maybe you weren't able to pursue it. You've got to change your project for some reason. That's fine. But if it happens, we do ask that you notify us immediately. That way we can make the appropriate changes essentially to your original application. We keep track of the project. We can confirm the project's eligibility, and we can move forward from there. We do require that you submit a year-end report at the end of each program year, which again is used in part to confirm you completed your proposed projects. We don't want to wait to the year-end report to find out you changed your proposed project, because if at that point we find that your proposed project is ineligible for the program, that can cause the kind of delays that result in you losing out on funding. And then, as I just mentioned, failure to complete approved projects or to alert HCAI to changes in approved projects can result in loss of funding. So if you do end up having to change your project, please let us know right away. There's no penalty for it. We just want to make sure we've got everything on the books properly and that those new projects are eligible. Next slide. And lastly, we've got links to some helpful information and the email address for program contacts. If you ever have a question about SHIP, you can reach out to us at the SHIP inbox at ship@hcai.ca.gov. And on the left there, we have links to HCAI's website, the CalSOAR webpage, the SHIP webpage, and the allowable investment search tool. That last one is the only one of these links not on HCAI's website. That is a tool made available by the feds as a reference for types of projects that might be allowable within the various categories. It is not an exhaustive reference. If you go to look up a project idea you have and you don't find any information on that allowable investment search tool, reach out to us. Let us know what the project is, and we can reach out to the feds and talk to them and see if it's allowable. Because unfortunately, the feds just don't always get around to updating it every year. And there are changes every year to what projects are allowable and what aren't. So next slide. And that's it. So from here, we're willing to open it up to questions.
All right. Thank you, Nathaniel. As you can see, our team has put a lot of hard work into this program, and we're excited that you've joined us today. We are going to open up for our question and answer session. And I still think we've got a small enough group that we can take questions live and see how that goes. So go ahead, and if you do have questions today, you can up at the top raise your hand, and we will answer your questions in the order received. Give everybody a chance to formulate any questions. Also, if you don't want to come off of mute and talk live, you can also enter your questions into the chat, and we can answer your questions through that as well. So 2 ways to participate. And I see we've got our first question here. Emily, go ahead. You're unmuted.
Hi. I have an existing HCAI account for a different hospital grant program. Will creating a profile for the rural organization affect any of that?
That's a really good question. It won't affect it, but you'll want to create a second user account. Either have someone else in your hospital create it or just use a second email address to create the user account. Okay.
Okay.
We do have the option of flipping back and forth between user types, but I recommend against it for something like this. Just because you don't want to kind of confuse the system or end up missing out on an opportunity because you were toggled to see one and not the other set. So yeah, having an account already, having those other organizational grants already in place won't impact it, but yeah, you'll want to create a second user account for this.
All right, great question. Thank you, Emily. Any other questions we've got out there today? And you can go ahead and raise your hand or put them in the chat. Also, we'll get the meeting resources have been posted in the chat as well. And so you can click on those. All of those are on our website. We are recording today and we'll be putting this on the website as well in about 7 to 10 business days. Any other questions for Nathaniel today on SHIP? And another option, if you do have a more detailed question and you need specific help, you can email our team at ship@hci.ca.gov, and we can reach out that way as well. Chat, all right. Oh, I see somebody's writing a chat question. Oh, we got a thank you. You're welcome, Christine. All right, Claire has a question in the chat. Are the funds competitive or do all the applicants with eligible projects receive funding? That's a great question.
It is a great question, and the funds are not competitive. All eligible applicants will receive funding so long as there is federal funding available. That doesn't mean that anyone gets cut out, as far as I know. It just means that if we have more applicants, each hospital receives a bit less.
All right, thank you for that question and the answer. Anybody else has a question today? And you can raise your hand and ask the question in person or enter it in the chat and we will read it for you. And highlight a couple of the resources that we've put in the chat. You can see that we have the grant guide link there. We also have a link to the funding portal and our application resource guide. So in there are all of the things that you'll need access to be able to fill this out. Peter has the next question. Can this funding used to purchase or lease automated dispensing cabinets like Pyxis or Omnicell?
Probably not. I checked the allowable investment tool, but off the top of my head, I'm gonna guess it's not likely. The grant funds are intended to focus on hardware, software, and training. I am not sure that automated dispensing cabinets fall under the Fed's definition of hardware for this purpose. But feel free to check the investment tool, or if you prefer, you can just email us that question and we can check the investment tool for you and check with the Feds and see what they say.
All right, Peter, thank you for that question. Alexia has the next question. Can we purchase telehealth equipment with this grant?
Yeah, that's a good question. Technically yes, but not telecommunications equipment, so it's a little touchy. You would want to specify what equipment you're looking to purchase in any kind of project proposal for that, and then we confirm whether or not it meets the criteria.
All right, thank you for that question and that answer. And we've got another one is coming in right now. Nathaniel made the point too, if we don't fully answer your question or you still need help, please do email the team, ship@hci.ca.gov.
Absolutely.
All right, I still see Adelie's still working on the question there. got some typing happening.
Change in this year versus previous year. Could you? I don't think there was a change. HCAPs should still be allowable. I don't believe there was any changes in that regard. And if there were, I don't think HCAPs would have fallen out of eligibility. I haven't heard anything that it had, so you should be okay with HCAPs.
And just to make sure the question gets put into the recording, did the value-based purchasing activities criteria change this year versus previous years? Could we use the VBP to improve the data collection of the HCAPS composite scores? So
yes.
Question to the answer there. Play a little Jeopardy on this one. Yeah. All right. Great question. Thank you. Again, you can raise your hand if you have a question, or just like I did there, or you can enter it in the chat. A couple different ways to interact with us today. These are all excellent questions, and we're here to answer them right now. And another thing I'd like to add, by participating with us today, you did get your email added into our list that we will be communicating with. We do ask that if you know others that maybe don't know about this program, please share that with them. We appreciate getting the word out as far as we can. So if you know somebody who should be on this webinar and isn't, please send that along.
Absolutely. This program is open to all small rural hospitals, but we don't necessarily have contact information for all small rural hospitals in California. So if you want to pass the word through your networks, please feel free.
Absolutely. We appreciate that. All right, Peter's got another question here. Can we use this fund for DSCSA, Drug Supply Chain Security Act tracking software?
That is a first, Peter. I don't know. Please email that question to us, and I will check with the feds on that one. I honestly don't know off the top of my head.
All right, great question. So yeah, Peter, send that to ship at hci.ca.gov. All right, these are some good questions. We like it when we get new questions too. That helps us improve our programs as well. So
absolutely, we learn. I find out the answer now. Next time someone asks, I'll have it ready.
We'll know. That's right. And we'll give a couple more minutes here for a question and answer if anybody else still has some questions. We want to make sure that we use the time that we have today to get those questions answered for you guys. All right, I see another one is coming up in the chat here. We do encourage you to look through the grant guide, and if there are any questions that come up from that, please let us know as well. All right, Casey asks, can we use the funds for policy tracking software?
Policy tracking software. Possibly. That could fall under, it would depend on the project, but it could fall under training and quality of care improvement. So, I'd be willing to pitch that to the feds. Let's put it that way.
All right, it looks like Casey's providing maybe some clarification to that one. And I did see a hand go up, but it went back down. So, all right, Casey says thank you, and yeah, I did see a hand pop up for just a second there, and went back down. If you do have a question, go ahead and raise it or put it in the chat, and we'd be happy to answer. Give ourselves about another minute here before we transition to the end of the webinar if there's no more questions. And if you haven't been to our website, we do encourage you to look around at all of the programs that we have, and we have a number of different programs out there to support a wide range of different health professionals as well. And so definitely encourage you to take a look if you're not familiar with our programming. Looks like we may be done with the question and answer. I don't see anybody else popping up there. So Nathaniel, thank you for answering all those questions. Everybody, thank you for your participation in the question and answer. Those were great questions, and we are here to answer them. So again, please email the team at ship.hci.ca.gov if you have any more questions. As a reminder, we will be posting the recording of this webinar and the one that we hosted this morning on our website in approximately 7 to 10 business days. You can also find the slide deck on the website as well. We appreciate everybody joining us today to learn more about the SHIP grant. We're excited to be able to offer it as a part of our health workforce development efforts here at HCAI and are grateful for your participation with us today. We do encourage you to go to our website to discover all the great resources that HCAI offers. And as a reminder, this application cycle for the SHIP program closes January 15th. Thank you so much for attending. And with that, we conclude today's webinar. Have a wonderful day.
Thank you, everybody.